I think we all agree that when we were growing up, as little girls, 10, 11, 12 years old, we all received the book, Are You There, Goddess? Me, Margaret. Okay? And I would go through every page, like just really diving in. Then you get pregnant and your mom gives you what to expect when you're expecting. You have every single week of what's happening inside your body and you're enthralled. And every week I would be like, oh my God, okay, on Tuesday I can change the page, right? And then when you go into menopause,
they leave you for dead.
You're fucked. You're on your own.
They leave, or not.
They just leave you.
Done.
And, you know, a lot of times I would feel bad because it was right after the pandemic and I'm gaining weight and I'm feeling tired and I'm not feeling sexy and I'm not feeling pretty and I'm mean and just gross. And I'm like, I'm not going down like this. I'm not going down like this.
And nobody's there to tell you it's okay. There's an option. Mm-hmm. My GYN said to me, you could sweat your butt off in the gym every day for an hour. You're not going to lose the weight. It's there. This is part of it. And I said, that can't be. She said, it really is. So we've got to look at other alternatives, which we haven't really perfected yet. But
well, that goes along with the thought process. When you go to a doctor as a woman in general, it's your hormones when you have hormones, right? You're just, premenstrual, you're feeling mood swings. They don't look at all of the other things that could be happening. They just blame it on your hormones.
Right.
Or then the lack thereof. And then you're just kind of left out there without any really good resources to do a million, all kinds of research. And for the most part, we go after girlfriends.
Well, that's what I think. You're exactly right. That's what I think is happening at this point because last night I went to the premiere of the M Factor. Tamsin Fidel from Pix 11 did an incredible documentary with all different types of women from all over the world talking about the fact that it's been a secret for so long. No one wants to talk about it because they think, oh my gosh, it makes you old.
Yeah,
it
I don't want to admit it.
Yep. You are grandma now.
Yep.
Now, girlfriend, you are put your house coat on and there you go.
It's like the plastic surgery. Nobody wants to admit to it, except for me, of course. But nobody wants to talk about it.
I love it. But at the end, they did a Q&A. And with all these factors, there's 2 billion women in the world or 1 billion women in the world. And the amount of dollars spent on research with menopause is minuscule. When a doctor goes through medical school, they get 1 to 2 hours of training on menopause. And now you want to tell me what to do with my body?
Yeah. Well, that's why they move so quickly for surgery. So let's just take it all out because then we don't have to deal with it.
Right.
And when the doctor said that to me and I was bought into it, the night before the surgery, I said, no, we're not going to take everything. You said the ovaries are okay. My ovaries are good. I'm keeping them. And I questioned him.
And they act surprised, right?
Totally surprised. Yeah. And I said, no, it's my decision. It was, thank God, the best decision because the menopause still set in. The 90-year-old woman still invaded me.
How dare she?
It was really scary.
Yeah.
And I remember going back to the office about 12 weeks after the surgery, crying, saying, now what? You had no plan. So you have the surgery scheduled. We do it. And now what?
And that's a big deal. That's a traumatic surgery.
Completely.
It's a big, no matter whether it's done laparoscopically or, midline incision, which can be disfiguring. If you need it, you need it. The surgery alone is traumatic.
Right.
Yeah.
And, and mentally, like now I've had a hysterectomy, that throws you into like another, I'm older, I feel older, I've lost a body part, and your body knows you've lost a major organ.
Right. And how about this, Ingrid? Sharon and I, not by any of our doing, both wound up at an oncology specialist.
I didn't want to say it.
That's where they initially sent us.
Yeah.
They said, issues, whatever the issues were, different for her, different for me. But we both wound up in the same waiting room at an oncologist, a GYN who specializes in oncology.
Wait, did you actually go the same time you met there, or you just knew that?
Within a few months of each other?
When we started talking, and what's really interesting is when we started talking about it, because again, we go to our girlfriends.
And that's where we get the information
But to sit
from.
in that waiting room and you look to the left and the right, and there's women who clearly are going through chemotherapy, and you're sitting there and you're trusting your doctor, and you don't really know what the outcome is going to be, but he's just told you something that's really doesn't sound good.
Right.
And you're just thinking, okay, so, it's just a change of my life, but what's the oncology piece? So I think that the medical industry, they move very quickly to just, it's done, it's over. We've got to treat this this could turn into something, really catastrophic for you. And you get scared and you listen and you don't question. And that's why you have to talk to your girlfriends.
So here's an interesting.
So true. I feel so bad because I don't trust doctors that much anymore about anything. I always do my own research and I ask a million people. You have to be in charge of your own health.
And talk to everyone you can.
Yeah. And that's why it's so important that we're talking about this, because I'll tell you, there's a little part of me that sometimes it doesn't want to talk about this because I don't want anyone to think, oh my gosh, do you care that much about the way you look?
But it's not only about the way you look.
Do you care that much about,
such a small part of it.
Do you care that much about getting older? Are you that afraid to get older?
Yes.
And so I almost feel like, wow, there's a lot of people on this planet that are going through so much worse and they're very sick. How dare I give a shit about, oh my gosh, my wrinkles or my age? I'm just happy to be healthy and alive, but I'm not going down like that.
But getting older is a
you
blessing.
Want to be okay with your wrinkles and your dry vagina and your dried up skin. That's good. That's good for you. But I don't want to do that.
Right.
But it's not.
And you shouldn't feel bad about
that. No. And there should
for the record, my vagina's not dry.
I haven't had that issue, thank God.
I feel neither have I.
Thank God. Yeah.
But it's not only about the appearance. Yes, that's a big piece of it for us, right? And we're girlfriends, and of course, we are friends, and we kind of feel the same way. It's our crew. But every woman going through this change of life has to feel some kind of way. I mean, it affects you, even if you don't care as much about the skin or the wrinkle, but you care about maybe you care about the dry vagina. Maybe you have that. Maybe you are bloated. Maybe you're athletic and you're in the gym every day and you went from being really curvy your whole life and for no reason at all, you're boxy.
Right. Yeah.
I mean, I'm the first one to tell you I had a tummy tuck in case there's anyone that doesn't know, I had a tummy tuck. Made me really
you look damn
curvy.
good.
Well, thank you.
Damn.
No original
Great
parts.
surgery.
But that's natural, your ass.
Yes, that's one of my few original parts that they're mine. When you have lipo every place else, people don't tell you. So lipo is not a method of weight loss or a license to eat. So when you gain weight, you may gain it more evenly, and then it will expand in other places where you have not had lipo. So on my actual ass, I have not had lipo. So pop. So that's a good thing.
Wow, that's nice.
Even for me, who has had the surgery and the plication, the pull together and the curvier waist, I noticed. What does that mean?
I need to get into. Stop right there, please. Tell me more.
With a good tummy tuck or full tummy tuck, they're plicating the fascia. They're bringing together the muscles.
I need to plicate my fascia.
Lateral plication is the best thing in the world. However, I noticed for me, I was starting to look straighter. I was always very curvy, and I loved that I was very curvy.
Yeah.
And all of a sudden, when I gained weight, it wasn't just in my ass. It wasn't. My waist was getting wider. Why do we just get wider? Why do we get like a barrel? What happened? Right? And I think what's happening is visceral fat. I think we're actually gaining weight. So visceral fat is fat we're gaining around our organs, like
caused by stress, brought on by menopause,
stress. Brought on by menopause. We don't have the hormones that are fighting and keeping us young. Right. So I guess to my point, it's not only about necessarily the vanity things that, we may feel really strongly about, but it could be the girl who works out really hard and doesn't like that she's not curvy, not out of vanity. She just works hard for her body. It could be the change in sex life, sex drive. So many things. Hair loss.
Right, the hair loss.
The whites of our eyes change.
Right.
That's why I have Lumify.
Right. And how many women
Lumify is my friend.
Don't even
would
know
say
about
to you, my brows, first sign of it, right?
Brows fall off, thyroids,
lashes.
Oh my God, my daughter's here right now. I think she's going to just run out of the room. This is the sign.
It's a great education,
but
though.
Nobody tells you. So,
nobody tells you.
So going back to that, my mother's mother was always hair, makeup. My my other grandmother was in a house coat at 50, right?
Right.
So my
Yes.
mother, you will not see
The
my
mother.
mother leave and go to the supermarket without
Yeah.
being complete, right, Sophia?
Yeah.
Completely decked out, lipstick, the whole 9 yards. But that's what I learned from.
Right.
So it's not like I'm vain. This was what I knew. This is
Right.
what I grew up
Those
with.
are your role models.
Like my mother told me this morning that unfortunately I was, unfortunately you have your dad's skin with the big pores and, you don't have my skin.
There's a laser for that.
But this is what,
Yeah.
and she doesn't mean it to be bitchy,
Right.
but she's like literally telling me, I'm sorry,
Yeah.
sorry,
Well, it's
but
their
you
way
have
of
big
wanting.
pores.
It's their way of wanting to pass down so you understand what's coming.
Right.
Because where do we learn what's coming? From our mothers, which is not always where we want to hear it.
Right, but my mother never told me about menopause. What she told me was hormones were not good for you,
Right.
and you just need to get through it. And my mother tells me everything. We have a very close relationship. But even this morning when I was on the phone with her, she said, I was telling her, okay, what about the period and the pregnancy? We all know about that. Right. But you didn't tell me about menopause. She said, well, most people keep that a secret. And I said,
Well, the secret's
but in
out.
her world, they did. They didn't
They
talk about
absolutely
that.
did.
Well, listen, back in the day, they didn't really talk about when you got your period. It was our daughter's generation that we had the book. Maybe we got the book. My grandmother, it was an embarrassment. When you get your period, you don't tell anybody.
Right.
Right.
So through the generations,
But
it really
now
does
it's funny
change.
because they do. Because I remember when Sophia got her period, she was like, Dad, I got my period.
Because now it's acceptable.
We won't put that on Sophia, don't worry.
We'll cut that.
But we have to make it acceptable, which is, I think, part of the goal of why I'm here, and I think we're all here, to talk about it, to share the tips, the tricks, the secrets, the things that we learned as an additional resource for the things the doctors
And
aren't
how about the
telling
women
you.
who did know about it that didn't tell anyone, who kept it a secret? Because there was always that aunt in the family that had amazing skin, amazing hair.
little
She looked
bitch.
incredible. They were on Premarin.
She also,
Who knew about it?
What is that? Why don't I know
Premarin?
about that? What is Premarin?
It's
horse
a hormone.
urine.
Yeah.
Horse urine?
It's horse urine.
Yeah, but it's like it was a miracle pill that they were all taking, and well, not all, many, but no one talked about it.
Okay, where is the urine?
So you
the,
had to
the
have-
horse urine now.
I don't know
been
about
tweaked.
today. I think
It's been tweaked and it's been
so many
changed.
contraindications. You got to make sure that
I need
there's
to go
no
buy a horse.
BRCA. Got to do a really significant medical background to make sure there's no contraindications with cancer in your family. But there were many women on it, and it was prescribed by doctors. They were all men. Now today we have GYNs that are women. Our moms and grandmothers didn't have that.
Right.
They all went to a man who, how much did he really understand? Whatever they told him.
Or care
Right.
to understand.
Right.
There was no training for it.
No.
They didn't know.
And you brought up medical. You said what is it about the medical side of things? So how many women now are in leadership? More than ever. Both sides of the aisle. They understand because they're not in their 20s. They're on average 40-something, right?
That's exactly what they said in the documentary,
Yeah.
that women are in the prime when they're between 40 and
Right.
55, 60. You've already had your kids are gone,
Right.
and you are a badass, and you're smart, and
Absolutely.
you can
Right.
run circles around these
Right.
18-year-olds.
Absolutely.
As far
so
as your
why
knowledge.
aren't they having the conversation amongst each other saying that we need to bring this to everyone, and all of our constituents are going through it? These
Right.
women that we know that are, every woman mostly working, right? You have double income households in most large states, big cities. So we're working, we're doing what we always do. We do everything, right? So we're taking care of the household, internal, external, trying to take care of ourselves, running on empty. So when most of us find out there's this issue with the hormones and we get the blood panels done, I've been told by 2 doctors, how are you functioning? Like, you've got nothing. You're running on fumes.
Flatlined.
That was how it was put to me. And I said, okay, so what does that mean? Well, you have no testosterone, you have very low estrogen, your progesterone, non-existent. And so now let's start figuring out what the medications are going to look like, And so is it medication prescription versus something that's safe and natural for you? And so it's a long road, though, because the road starts with, and I thought I would show everyone, for me, what the hormone therapy looks like
Oh my God.
just on one side. So that is compounded hormones. So this is just in this year. The different colors indicate different
hell
dates.
is this?
And all the changes in the prescription. Oh, wait, there's one more. Hold on. This is what I take at night. This is for sleep, for mood. They call
I
it the
need
feel
that.
good.
Sleep and mood,
This is your
right?
progesterone. Every woman needs it. These are compounds of testosterone, estrogen, and something
That's why
else.
you look so
I
damn
forget.
hot, Dana.
Well, I am hot. I'm sweating actually right now. And, you know, that's only part of it. Then there's the eyeglasses. There's, you know,
we'll talk
retinol.
about-
Retinol you can use all over your body now. You don't have to use it just on your face. It's
Oh,
great
yeah,
for
I
hair
slather
growth if
that
you
shit
need that.
on.
Your eyes, what happens to your eyes? All of a sudden you
Dry
can't
eye.
see. You have eye
Ooh, I
issues.
like this. You brought your
So,
arsenal.
Yeah.
And this is
But
what I
it's
think that people
pain in
really
the neck,
need
though.
to see.
It's pain in the neck.
Yeah, but you did it all. And
There's
you
got to
did
be
the
an easier
research.
way. Yeah.
I need to know more about this.
Well, it's
So-
interesting. I feel like there should be, I'm sorry to interrupt you. Remember when we were young and they put us on birth control pills, or we went on birth control pills, and there was like the dial, and it was one little pill, and it told you this week you took that. If you had the one that was the try, whatever
You
it
get
was.
a little less, you get a little more.
Right.
Right.
And so you start this day, and then it kind of did it for you. Turn the dial, you pop out your pill.
Right.
And we should get there, because instead of carrying around all of that, what if you take the wrong thing on the wrong day? What happens?
Yeah.
Are you in a bad mood? Are you wide awake? What
Oh
goes
yeah,
on?
some of this is
Right?
for the morning, some is it for night. Then you have to alternate where you put it. You can't forget to take it, because if you forget to take it, you feel it
Crash.
Really?
48 hours later. Like it's not easy. And these are all compounded from yams, so they're natural based. Are they effective? Yes, but here's the other thing: they work. You feel good, and then all of a sudden, a year or so later, you're like, I feel the same again. They stop working. Now you have to reformulate, and the doctor has to make a new prescription and start changing and looking at blood levels. So
Shouldn't they
this
be
is
doing blood levels every 3 months with that?
well, every 6 months my doctor does, but that's the issue. So you're always changing, so the prescriptions change with you. So it's a job.
Right, it's a full-time
Yeah,
job.
so your
Just to stay
menopause
normal and
is a
sane.
job.
Yet another job.
Yeah.
Okay.
Yep.
We're here for it.
Yep.
When was the first time that someone other than your doctor mentioned to you that they thought maybe you were either a little bit nutty or going through menopause, where they were implying that you're a crazy bitch?
Oh, that shit happened a long time ago. Way before menopause.
I was going to say the same thing before menopause,
We've been
Yeah.
a little crazy our whole
and not by a
lives.
doctor.
Yeah.
Not by a doctor, right? Because I didn't know how to differentiate. Am I going a little batshit crazy because I'm going through menopause or premenopausal, or is that just me?
Well, can I say something? And I think this is an important thing to acknowledge and note. As we get older, it's not just menopause. Like, yes, this is all about menopause, and I'm here for it, and I agree. But life gets busier. We are more tired, not just because of menopause. We're older.
Right.
And the kids get bigger, or grown, but they still need a lot from us. I know, my kids still, I do a lot. Hopefully we're in a home that we've, created and we've built, and there's a lot to do. And our jobs, if we're blessed and we took that path, not everyone
Right.
did, and that's fine. Maybe we have a business to run or an important job that we've worked for
Right.
all these years. Working out, staying in shape gets harder, not just because of menopause, because we're older.
Right.
Aging. Yeah.
So
I don't want to hear that.
You
though.
run out of,
Yeah.
but you run out of
Sharon,
patience.
I don't want to hear that.
I'm sorry, but don't you feel like
It's
it's
our reality.
true? How
I do feel like it's true, but I feel when someone tells me, "Well, you're getting older," I get infuriated with them. I don't know why.
It's a
so
blessing
weird.
versus the
It is a blessing.
alternative.
It is a blessing.
How many people don't get
To grow
the
older.
opportunity?
Right.
Someone said this to me that was older than me. Everyone wants to grow old, but no one wants to be old. Mm-hmm. Right.
That's a good point.
And you know what? I come from a background I've been, those who know me, probably everyone, I have worked in plastics for 30 years. So I always knew I was going down fighting aesthetically, right? But you're not prepared for the feelings that come with it. And when the expectation is you're always going to look a certain way, you're always going to feel a certain way, it is infuriating.
Right.
And our patience are shorter. So yes, it ties into menopause, but just aging, right? So it does make you a little crazy.
Yeah, I think it's a really big deal once you're, in a, for me, when I was 18, 19, 20, even into my 30s, when you look a certain way and people perceive you as looking a certain way,
Right.
and then
And then you
you
walk
take a
into the
shower
room and
and
you
you look at your
expect-
ass and you're like, what?
Whose ass is that?
Who is that?
Whose ass is
Or
that?
you still see yourself that way, and then your kids say to you, you can't wear that.
Exactly.
How dare they?
Oh my God. My
How
daughter's
dare
never
they?
said that to me, Sophia.
So-
Have you?
Part of it, right? So
Yeah.
Absolutely.
because maybe you're so positive, you don't even see that actually happening.
Right.
You still see yourself in your 20s.
Well, sometimes
And
I
you want to
catch
stay there.
myself.
Yeah.
Somebody's got to give you a little
Heads
tap on
up.
the shoulder and say, you got to cool it.
Yeah.
Just a little bit.
Sometimes I
Just bring
catch
that crop
myself.
chop down
Yeah.
just a
little
little
bit.
bit. Just a little bit.
A little bit.
Yeah.
Yeah. But now, as far as you're concerned, what, have you always thought that you were going to have plastic surgery? Have you always thought when that time comes, I'm going to have this done or that done?
So no,
I love that you're so open about it. I do.
Why,
I
but
think it's
why
amazing.
wouldn't I be? Like,
Especially in your business. I mean,
why wouldn't
look
I
at
be?
you. When she walked in the door, I was
Yeah.
like, damn.
Thank you. You know what? I didn't know when I was really young. When I started my first job in plastics, I was 25 years old. And I remember the doctor telling me, women are going to come in and tell you they feel like this happened to them overnight. And I sympathized with these poor older women that felt that way, but I couldn't empathize because I had no idea what it would
does
feel
that
like.
mean?
Right.
Yeah.
Right? And I did see it that way. And now I empathize because I wake up every day and I see something that wasn't there yesterday, or at least I didn't notice it yesterday. I mean, I say, God does this thing for us. He makes our eyes go bad as we get older.
God.
That's why I'm here.
Yeah.
So, and these are prescription, by the way, because
Yeah, I
I
love
can't
those.
see close without, and now I need distance. I had perfect eyesight. So these things creep up on you. All of these things happen. So to answer your question, no, I didn't plan this procedure and that, but I was always really familiar, with the changes that people went through as they had children, as they aged, as they gained and lost weight. So I knew what the options were that would be available to me.
Right. But how great for you, you had the exposure to that, right? So you had this real life experience. So, you look at different backgrounds. So coming from a very traditional Italian family, my mom spoke about nothing.
Nothing.
That's why I share. Because
Right.
so many people didn't have the opportunity to really ask the questions.
Right.
And I want to tell people what I've done, how it went for me, the good, the bad. I've seen a lot of things because I do think that stigma, and it's okay if you want to keep it a secret. And there are more people, I think, that come from a traditional or a background like yours that maybe
Right.
people weren't so open. So that is why I
They
share.
were shut down, closed. Would you agree, Ingrid?
Yeah, I mean, my mother wasn't, but the rest of the family was. Like someone could be dying of cancer at their last breath, and
They have
you
a head
wouldn't know
cold,
it.
look the
They have
other
a
way.
cold, yeah.
Yeah.
Yeah, you don't talk about things
No.
like that. Yeah.
Yeah.
A lot of self-education definitely has to take place unless you know a Sharon. If you don't know Sharon,
Right, but that's why I
Right?
feel as though, I didn't know where to go, and I still don't really know where to go, right? I mean, I have you guys as resources, and now with seeing that documentary, The M Factor last night, I think we have a little bit better of an idea where we can go for resources. But listen, if you break your leg, there's a bazillion places to go.
right?
If you need glasses, there's a million places to go. There are not a lot of educated people on menopause that know a holistic route as well as, they have to have, for me, they have to have both aspects.
I don't think healthcare has actually defined it as for some people, it could be an illness, right? So depending on, not for myself, but I've seen women go through menopause that have really, osteoporosis is one of the big indicators.
That's what I feel.
Right. So if you look at some of these different medical conditions that are part of, how is it not considered a medical diagnosis?
Right.
Well, so
That's
that was
what I want to know.
That was exactly what I was going to say next. You showed us this
Oh, by the way, none of that's covered
Thank
by
you.
my
That was
insurance.
my-
So
thank
it's
you.
all pay out
That's
of
another
pocket.
thing.
So
What do you
There's
mean
no
it's not
code
covered
for
under
it.
insurance?
Yeah, no.
Right.
It's all, and it's very expensive.
Of course
That's
it
the other
is.
part. So the doctor is expensive, not covered. The medications,
How do
very
we change that?
expensive. Oh, we can change that. There's roots for that.
Yeah.
We've just got to sit down with the lawmakers and tell them that this is a women's issue. And by the way, it's 2024. We've had like the craziest year. There's so many things going on in this world. where are the women with the voices who are not standing up for, there's a list of things I could think of, this included.
Yeah.
Absolutely.
Where are the women with the big, big platforms and voices not speaking up?
That's why we're here.
But we can change that.
Yeah. This will be a movement because people are not staying silent anymore.
Right.
And women want more for themselves, and they want more for their daughters, and they want their
Right.
daughters to know, you know, that maybe they fought for this and you don't have to stay in the dark.
Right.
I mean, a woman got up last night and she said that she was going through perimenopause, and on several occasions she had such bad heart palpitations and anxiety that they thought that she was going crazy. And it turned out after like 8 or 9 months of her being in excruciating,
Symptoms.
symptoms.
Symptomatic,
It was her hormones. And she said the first thing that people said was, you're having an anxiety attack. You must be stressed out. And didn't even, for months, even talk about her hormones. So I think that is just...
Yeah.
Well, what about when they tell you you're perimenopause, premenopause, whatever they say, and it's your hormones, but they don't give you anything to any takeaway?
Right.
Okay, so this is the problem.
Or they get the
But
blood
they-
work results and they say, no, your levels look good. Well, wait a minute. Can you just explain to me what the range is on each different hormone?
Right.
I don't want to have to do the research myself because I may not necessarily understand it when I'm reading it.
But you know it's out of range.
Yeah, or I know something's wrong. So like if it's out of range, like what does that mean? If it's on the, where is that support from the doctor to say that I'm going to explain this to you and I'm going to tell you everything that I know about it. And I encourage you to do your own research as well.
Well,
and
so-
then we meet again and we come up with a plan.
Right.
There is another thing that I think that everyone should know. There are functional medicine providers that what they consider in range. So I've taken blood work, not only for this, but for other health concerns. I have a dear friend who is a functional medicine provider. And when she looked at the blood work that was in range given to me or, put out by the lab.
From
In range, go ahead.
It was so far out of range of where, it really should be for optimum health, right? Not necessarily. So I think that the regular doctor, maybe, okay, so you're in range here. So you're not dying. So you're in range.
Right.
But you're so far low or high that it can really affect your health.
Right.
But as long as you're in range as to their, their terms or their, guidelines, you're good, go home.
Well, that's the thing. It's so sad because you think about going to someone that practices functional medicine, and I think dollar signs, because that's not covered.
Yeah.
Nothing is covered. So if you really want to get down and dirty about how
It's
you can help
unfortunate.
yourself, it costs you thousands and thousands of dollars.
Right.
It does. It
The
just
blood
does.
work is out of pocket. The visits are
and
out
that
of
is
pocket.
just absolutely wrong.
Unacceptable.
And then, you're doing all of this on a massive lack of sleep, because let's talk about sleep. That's
Oh,
one of the
God.
biggest things
Talk
that
about sleep.
it's
I
the
don't
biggest
sleep
disruptor
anyway.
and one of the first signs for anyone who's going through menopause. And what do they say? People who don't sleep can become depressed. They can become angry.
I feel like you're going crazy.
Right.
Then you
And
really feel like you're going
but
crazy.
now you've got someone who's running a household, who's working, maybe has a business, career, kids, whatever their responsibilities are. So they're keeping it all in. So now they're just internalizing it. And what happens? Now there's anger, right?
Anger.
And then you
No, the
display the
anger.
anger because you're only
Right,
you're
Sophia?
only allowed to display
The
happiness. If you
anger.
display anger,
Let's
everybody
talk
gets
about
all
the anger.
And then,
They don't know how
then
to
your
handle
family
it.
tells you're crazy.
Exactly.
You're acting
Crazy
crazy. Why
and
are you acting
angry.
crazy?
That is
now
my
you,
life.
Now you got a really big problem.
Yeah.
So, but you got to pay attention. If your sleep is off and you feel exhausted all the time and you've asked your doctor to check your thyroid, and don't they always say, oh, no,
Oh,
your
you're
thyroid's fine. How many times have we all heard our friends
Yeah.
and our doctors say to us, your thyroid's fine? And then you go to an endocrinologist who checks your thyroid and it's not fine. So it's a really big list.
I'm
of
confused
things
right
you
now,
have
and
to
my
do.
head is blowing up. Like with all this information that I got last night, today, it's like, just tell me what to do. I need a manual.
Yeah.
But it's
Okay, if
different
this
for
happens, I
everybody.
know,
Everyone,
I know.
yeah.
It's
I know,
different
I know.
for everyone. And if it was more readily available with, again, you shouldn't have to be wealthy to be able to afford good health care. And
You're
this
right.
is part of good health care. This is part. If it was happening, and I hope I'm not opening a can of worms, but if this was happening to a man,
Oh, let's talk about that.
I mean,
you want to talk about erectile dysfunction? They put billions of dollars into that. Prostate. I mean,
easy little pill solves it in 5 seconds.
Yep.
Right.
Well, solves it for them anyway.
Right. Creates another problem for us.
Right. Exactly.
For the ones who are not dry.
So, yeah, no.
But you see the wives then running for those testosterone patches. Then, I mean.
Right. And
I think I want to try that.
Yeah.
Should I try it?
Viagra or the testosterone?
Testosterone patch. I want to try it, I think.
Yeah. Make sure get your blood work done first. Make sure that your testosterone's low. Because if you don't need it and you take it,
I'm going to grow a beard.
Unbearable.
You can't
really can grow a beard. Yeah.
Something
that's why I shave. No,
everybody really has to know, though, the takeaway when we are collecting information, if anyone's collecting information from this conversation, you still have to go. You can't start going online and getting hormone replacement and thinking, you know what, these ladies spoke about it, sounds good, now I got some information, because people will do that.
Right, and there are pre-existing conditions where it's not good for you. And
contraindications.
Right.
It has to go with
Familial
your blood
history.
work.
Yeah.
Absolutely. The three of us sitting here, and I'm going to look right at the camera that's mine, that one's mine, right? For the three of us sitting here, we could all need something completely different.
Yes.
And if I went into Dana's little bag of tricks and did exactly what she was doing, because
a lot of people would
hey,
like to get into
doing
Dana's little bag of tricks.
That could be so harmful to me and make me feel so much worse, even though it's perfect for her.
Right, absolutely.
So no one can play their own doctor. If it's not something affordable, if you can't find the right provider to send you in the right direction to get the right labs, don't just mess around with hormone replacement, because it really can create problems.
Absolutely.
I will say one thing that might be a little controversial. After the pandemic, when I was 197 pounds, because I decided that, well, during the pandemic at 4 p.m. every day, I would open a bottle of wine and I would just drink and eat and whatever.
What else was there to do?
What else was there to do? So after that, when I found myself in this position where I was completely blown up, I was getting depressed. I just wasn't feeling myself. I went to the doctor. I had high liver.
Or fatty liver.
Right, a fatty liver.
Yeah.
So my doctor took blood work, and after 6 months, she said, I think you would be a candidate for Ozempic. Okay? Now,
and in comes Ozempic.
And in comes Ozempic.
Amen.
And if you told me, now I lost almost 30 pounds. I feel completely different because the amount of time and energy spent in my brain worried about the way I looked and upset about how fat I was and upset about the fact that I would just be so lazy. My kids told me that they thought I had agoraphobia. I mean, it got very bad.
I think people did.
But in the same breath, I will go on record saying, I promise you that they're going to find that Ozempic is good for people with OCD, with addiction problems, with smoking, with
Friends
so
of
many
mine
things.
that have been on Mounjaro, and myself included, I can't drink a glass of red wine anymore.
Right, I can't
so
really.
it has a hormone in it. It completely shuts down the craving center that you don't want to look for candy, cookies. My girlfriend, life-changing, stopped drinking, had what she would call a problem. I won't call it that because it's personal to her. Completely stopped drinking, and they're saying that it's good for brain function going forward, that even when it comes to Alzheimer's, dementia. So heart for women, so important, right? Our liver, all the different systems of our body. Thank God for Mounjaro and Ozempic.
Yeah, no, I really think that it's a life-changing drug. And if you told me,
no shaming.
my mother tells me to this day, she's like, well, you don't know what's going to happen in 20 years. And I'll tell you this, if you told me I'm going to take 2 fingers from you, or you can be on Ozempic, I will say, take my damn fingers. Because that's how bad I felt. And the way I feel now is just so different.
Totally life-changing. And so you're regulating your blood sugars, right? Isn't that your blood levels with the Ozempic, with the Mounjaro?
Right, and it helps with inflammation.
Right, yes, inflammation. So people who
Why are you looking at me like that?
So
she's looking at me like
on
that.
Mounjaro, 25 pounds
Ozempic.
during
Mounjaro.
25 pounds
Maintenance.
during just went back on Monday. 25 pounds during the pandemic, and mind you,
gained or lost?
You gained.
Really?
25. Oh yeah, and again, menopause. Your body does you gain weight. Now you're home, and when we were first locked down, I was like, I'm exercising every day. I was off to a really good start.
Right.
After a while, you just say, fuck it. Right. And it took me a while. All my friends were on Mounjaro. I kept hearing about it. I'm afraid of taking anything.
Oh my God. She's afraid to take an aspirin.
I am not on any hormone replacement, which is another conversation.
So let me ask you something. You will go get a tummy tuck and get whatever, but you're afraid to take an aspirin.
Oh, yeah.
Well, I'm not that I'm afraid to. I don't want to take it unless I feel like I absolutely need it. And I'm concerned. I have a very weak stomach, and I'm concerned with side effects. Before I went on Mounjaro, I went to my primary care doctor, and I had a full blood panel because it does have effects on the thyroid, on the pancreas, right? So for every, 3 stories of great everything, there is one story of someone who did very, very poorly.
And they probably didn't do the background with a doctor who had the understanding, right?
Right. Maybe they didn't
and also
do
too,
the blood
when they say
work
like,
on
it's not, I'm having a problem, with my digestion. Well, you're drinking enough water. Like, you've got to do the work of what that medication says you need to do.
Right, and you also have to eat healthier.
Yes,
you can't go and eat, your French fries and whatever it is because you're not taking as many vitamins.
Right,
in.
you need protein.
So you need protein and you need.
Well, it needs to be medically managed.
Right.
Yeah.
Right? And all of a sudden there was an influx of 1-800 Mounjaro, and it was at your door.
Yeah.
And I'm not a proponent for that. I'm very much go to your doctor, go to a doctor, even if.
What do you agree with that? You shouldn't have it delivered like easy access?
No, I mean, I don't think it should be 1-800 Mounjaro. I think that you should be under a doctor's care. But I think that one thing that I will tell you that is if I go to the doctor and I tell them I want Mounjaro or I want hormone replacement therapy and they're like, that I really don't agree with that. I'd be,
then you're at the
peace
wrong
out.
doctor.
I'm at the wrong doctor.
Well, look, it depends where you're at. So I had
if I was
blood
crack
sugar.
skinny, I wouldn't, obviously I would expect the doctor to say, I'm sorry, you don't need it.
You have to, we forget that there is a demographic of all kinds of people. We think in terms of who we are and who our girlfriends are. That's just normal. That's, who we're surrounded by. There are people that are anorexic, that are bulimic, that want things like this because they're completely body dysmorphic.
Yeah,
and, we have to think very broad-based when you talk about medication in general. I'm no doctor. I have worked around doctors and around aesthetics for enough years to realize that all of it is a mindset, right? So yes, we're feeling a lot better because we feel more like ourselves, and so that does help with, if you're feeling a little depressed. Now you look great. Now you can wear clothes maybe that you're too old to wear. I don't know. It's the chicken or the egg.
Right.
Is it the drug that's making that's improving these things? So much goes on in our mind. So much has to do. You don't want to know what goes on in my mind, but so much is how we think, how we feel, how we look, how we walk into a room that changes the energy in the room. Yeah. So it's not always, that the drug, and I'm not saying it's not. Maybe they will discover this is, what was that movie back in the day with the serum? Death Becomes Her.
Mm-hmm. Right? Oh, I didn't see that. Should I watch it?
Oh, come on.
Yeah, you would like it.
Come on.
You would like
Who's in it?
What's her name?
That really
blonde.
pretty. No, well, yeah. So you have Kate. Is it not Kate Hudson?
I'm bad with all that.
Goldie Hawn.
Yeah.
Okay.
Yes.
Meryl Streep. And oh boy, I forgot who else. But anyway, I literally have a sticker on my phone. Make those little stickers of the brunette whose name I forget. Very pretty. Who sells this potion and she drinks it and her ass comes up and she's taller and she's thinner and her boobs, And so people are viewing Mounjaro as that or Ozempic as that. And very well maybe. I don't know. Maybe they found the fountain of youth.
My ass happened to get flatter, which is very sad.
When you're
But
losing,
we'll talk about that.
When you're losing weight quickly, you're losing muscle mass.
Right.
We went through an entire thing in my practice where everyone spoke about Ozempic face in the world of
Oh,
aesthetics.
yes, it's a real thing because I have Ozempic face and I was shooting myself up with anything I could get my hands on.
And that's not
You
always
could
the
have
answer.
seen me when I first started. I was like, okay, a little bit more Restylane over here, a little bit more of this over here. Now I went and I am injection free for the last 8 months just to see what I really look like.
Right.
But believe it or not, with all of my things, I have had a fat transfer in my face many years ago. I put a little in my lips. I'm definitely a Botox. I probably have enough Botox to kill a small rat. That being said, I don't put filler in my face.
And how about the fact that I found out recently that filler stays
Forever. Oh my God.
forever? They don't tell you that. They tell you to come back every 6 months.
Of course
That's
they
why
do.
there's pillow face.
Of
Right,
course,
right.
but
So-
that's trending out. in a big way now.
Thank goodness. But shame on these doctors that, if you went to get a filler, wherever you got it, not Botox, we're not talking about that.
Right, we're talking about
that they said,
sculpture
okay,
or-
I'll see you in 6 months.
Right.
Not supposed
Of
to do that.
course, because
2
it's a
years
business.
minimum.
Right, but also you can see your face deflating, so where did it go?
It changes, it migrates,
Yeah.
it integrates.
But they say it's always there.
I've had the opportunity to be in the operating room many, many times to watch surgical procedures. You can see when they undermine and separate the skin from the
I would
underlying
love to see
tissue.
that.
Oh, I've got video
Ooh,
for you,
yes.
honey.
Me.
I have
No,
my
thanks.
video. But you can
have your video?
I have my video.
You crazy bitch.
I'm a crazy bitch. But you can actually see where it's almost like it's stuck to, the skin is stuck to, or these products that we don't even know
Right.
what the long term, how long do they last? What do they do? I had something put in my face that I still swear I don't even know where, many, many years ago. And it was in there. It was like pebbled cement when the doctor went in there to lift.
But to your point with the back on the Mounjaro, the Ozempic, they're saying that those GLP compounded formulas that people are getting, they're doing, I believe it's, how often are they injecting? It's different than the Mounjaro and Ozempic. They're getting it from a compound person who makes it.
Right.
They're saying that they're not FDA approved, and they're very concerned about 5 to 10 years down the road what the negatives of that is going to be. And I don't think people know that. They're thinking, I'm going to go to the nurse practitioner, I'm going to get the compound, I'm going to get exactly what Ozempic or Mounjaro is.
But it's not.
And it's not. And they are not FDA approved. Do you think people know that? I
No.
know people that I've spoken to have no clue.
Right.
That's
They
a
have
problem.
no idea.
Yeah.
But that's, again, part of the problem, because it's not the medical care.
Right.
When it's aesthetic in many cases, or even hormone
But when
replacement,
it's too
not
private.
accessible.
Yeah.
It's too private. If we were more open about it, like we should actually have a doctor on talking about
Yeah,
that.
for sure. Yeah.
The next episode.
Yes, we can certainly get that. Look, there are a lot of doctors that I've spoken to that absolutely agree with everything we're saying. It's not all doctors,
Right.
but there's a stigma to how many people shamed me. You're on Mounjaro.
Oh, me too. The same
You're
thing.
on-
I didn't tell
There-
anyone for a
wait,
long time.
And
I was
tell
embarrassed.
everybody, I'm not embarrassed
Now I
about
tell
it.
everyone, but
There are people that were saying, how many people have diabetes and they need that medication?
Exactly.
You're stealing it from them?
you're stealing
I'm
it.
not
Like
stealing
you
it
would
from
ever
them.
steal
Everyone can get it.
medication from someone.
Come on.
Please
Come on.
tell me that you slapped them in the face. No, I'm kidding.
I think it was
You
on
would
the
never
phone.
do that.
But, I'm sure I said something nasty.
Right.
But this really is what goes on, and then
But in their defense too, that's what was being, mentioned in the news media.
In their
some
defense,
of
they're probably on it
when
now.
people are saying these things, sometimes
Yeah.
that's the information that they got.
Right.
So in their
Right.
defense too, fake news is everywhere.
Right.
But
Well,
we
look,
won't get into that.
we're not gonna get into that.
Save that for another episode.
Okay.
Yeah. Something, though, that I do think is important that people didn't know up until recently, when you're on a, again, I'm going to look into the camera for this one, it slows down your digestion.
When you're on
If
what?
you're
One
on
of the-
any of these
GLP.
any of them, Mounjaro, Ozempic, anything that works, slows down your digestion. For the longest time, there wasn't yet guidance when someone was having plastic surgery, any surgery for that matter. When they tell you NPO, no food for 12 hours, which is standard before anesthesia, now they're telling people to be off these drugs for 2 weeks or a month.
Why?
So their stomach empties properly.
Right.
So when they put them to sleep, they don't aspirate.
Right.
Oh my God.
Because
Wow.
we're NPO, we're no food by mouth for a certain amount of the hours for a reason, because we don't want that patient aspirating during surgery. We want an empty stomach. They tell you don't even chew a piece of gum. If you need to take a pill, a little sip of water. Have you had an experience where if you have
Yes.
it? Okay. When you're on these medications, there's food sitting in your stomach. I don't know how long it's sitting there.
Well, that's kind of gross too.
But that's true. That's true.
I wonder if you can detox on Mounjaro.
You need to
Oh,
go.
you definitely
off.
have to have the doctor help you to wean off of it. There's no question.
Yeah.
Yeah. But
See,
never went
I was
past the minimum
self-diagnosing
dose.
for a while because my husband was getting upset because he met me at 170 pounds, and he actually will say to me, I want you to gain another 10 pounds. I don't like you looking skinny.
Yeah.
which I don't really like me looking skinny. I'm big and I like myself big.
I
like
love
this.
looking skinny.
Right?
I love skinny scrawny. My husband doesn't,
Crack
but
skinny.
I like crack skinny.
So I like myself at 170 pounds, but I was getting down to 160 and whatever. So I started to take it once a month. In my head,
Right.
I'm like, okay, I'll just take it once a
Right.
month. And I was getting so sick because
course.
after the month,
Right.
it's already out of
It's
my
your
body.
system, right? And now
So-
it's a big shock because it's a bigger
Exactly. So I'm
milligram,
like, I
yeah.
wonder why I'm getting so sick
Yeah.
and whatever. So I did the consultation with the doctor, and then they put me just on a maintenance of 5.0. I went from 10
Right.
to 5 just to chill
I never
out.
exceeded the 2.5, the lowest dose.
Oh,
I
really?
stayed there. I lost what I needed to lose. I felt great for a while. Eventually, I did have, at 8 months, I had stomach issues. And I went off of it. I was off of it for a year. And I
But
really,
truth be told, you do have a
I have
sensitive
a-
stomach.
Yes, I
Right.
said that. To
Right.
begin with, I have a very sensitive stomach. Look, every medication is not for everybody.
Right.
Right.
It happens to work great for me for a period of time, and then it wasn't so great for me. And my functional medicine provider actually texted me recently because she's treating someone who had a stomach issue after being on it long term. And she said, "Did the stomach issue go away?" I said, "Yes, it did." And it went away enough that I gained, 5 pounds, and I went back on Monday.
Right.
What will we do for vanity? I think that's a whole other conversation.
Right.
Whatever it is, it's okay by me.
It's okay
with
by
you.
me too.
I'm
I'm
with
going
you.
down scratching and kicking.
With every last breath.
Look, we can go down gracefully. We can age gracefully, but still go down fighting.
Right.
Right? There are things that we can do that are not
It's
unhealthy.
also good for your brain to go down fighting, because if you're thinking and you're, focusing on doing something, whether it's you're supposed to change your behavior to keep your brain at high function, right, as you're aging. What's wrong with that? You're learning something new, you're changing your diet, you have more energy, maybe you're working out, maybe whatever it is that you're doing, you're keeping your brain functioning.
Right.
That's the key. You're learning something new. You're researching the medication, figuring out the hormones. God, is it ever going to be over? How long is menopause, by the way, supposed to last?
Okay,
you
so
die.
menopause till you die. That's what I
You're
learned
done.
last night.
I thought there was
When
like
you're
a 10-year window.
Well, you can. Okay, so for different nationalities, believe it or not, for African American women, menopause from premenopause to menopause could be 10 years. For white women, it's between 5 and 6.5 years. For
Oh, that's
and I have a
interesting.
problem
A Caucasian,
because
so-
it's been more than 6 years. So
But you're Sicilian, right?
yeah,
but for me, it's weird because
There you go.
I'm 57.
right, yeah,
So-
me too.
So I just this year stopped. But from what they told me last night, for the rest of your life, you will be in menopause. So there you go.
Really,
Yeah.
interesting.
So you'll probably boot me off the mic, the whole thing, and I was a girl that got my period at a very young age. I had endometriosis. I had a very hard time getting pregnant when I was starting, trying years ago. Thankfully, I have my 2 daughters, but I had a harder time when I was getting my period than when I started menopause. For me,
Oh,
it
wow.
hit. I had no hot flashes. I had no negative symptoms. I don't want hormone replacement for me. I happen to have fibroids, which is something I developed, and they are estrogen fed.
Right. Same for so many things that you just said. I wish I would have gone to. Sharon went to the second opinion doctor.
Yeah, we
The
went to
first
same-
doctor that we
yeah.
both wound up at. And again, this was not planned.
Yep.
I wish I would have went to the doctor she went to for the second opinion. I would have not had the partial hysterectomy. I was too young. It's going to be.
How old were you when that happened?
So it's going to be 10 years. So, I was
46?
Yeah, I was 46, 47. And I wasn't the girl who hated getting her period. I used to feel great when it was done and over with. Felt like I had new energy. I never had younger, I had the cramping and all that. But, in my adult life, it was great. I felt like my skin, everything was great. And I miss, how can I say it without not sounding weird? Like I miss what my body, how it would just
Cycle
bring
of
it.
it.
Yeah, the cycle of it coming back to feeling great because I had my period. And am I angry with the doctor? Yeah. And I've seen him out a few times in social circles, and he's friendly, and I'm a little cold, and I want to grab him on the side and tell him, you know what?
Why don't you?
You and
Oh, I
I
told
both know
him.
that surgery that you and my GYN put together, it wasn't necessary. It
I
wasn't.
told him.
Yeah.
When he came into the room and he said, look, I mean, you need to, and by the way, there were 2 doctors. They had a different approach, but the recommendation by 2 doctors, this fibroid that size, that has to come out.
Right.
One wanted to do it laparoscopically, which meant they needed to use, and I don't want to use the wrong, it's not coming to me, there's a tool that
The
they
Da
can
Vinci
actually,
surgery, which is
They-
the
it's-
laparoscopic, that's what I had.
so they
Yeah.
actually enclose the uterus in a bag, so to speak, kind of grind it up so they can pull it out through a tube if it's too big. However, my research, I
I don't know. I didn't ask all those details.
wanted every detail and I did my research. God forbid. So fibroids are, from what I'm no doctor, from what I learned and was told, fibroids are typically benign. But if you have one cancerous cell and it escapes that,
Right.
whatever they're
Starts a
doing in there,
cascading effect,
it
yeah.
could potentially contaminate the cavity where it is, right? So my option was an open surgery, and because the fibroid was so big, and that doctor scared the crap out of me. He said, "Oh, and we're going to make a midline incision because it's the safest thing for your life." And I said, "Do you believe I have cancer? Do you have any reason to say to me with a fair level of certainty that I am a cancer patient?" He said, "No. But you have to treat everybody as such, because what if it is?" Which is a fair statement from where he's
Sure.
standing.
Yeah.
And I'm sure his malpractice dictates that for him as well.
Right.
But what was I, 47, 46, And again, a little vain. I've had, a little work. To suggest a midline incision down the center of somebody's abdomen, which will destroy
Sounds
the
like the
appearance.
1950s to me, right?
Wow, yeah.
I didn't have that type of surgery. I luckily had the laparoscopic surgery, and I have, bad scarring.
But it's
from
not
it,
terrible.
but
I've seen
not,
it's not.
not like that.
Take your
midline
clothes off, let's
incision.
see.
When I went
I
to
will
the doctor, that's next episode. Stay tuned. When I went to the next doctor, who I'm still with, he said, first of all, we can watch this, we can monitor this, and if I need to go in there and actually do a hysterectomy, why can't I do it through your tummy tuck incision? Why can't we create a C-section scar and
So
go in
smart.
that way? And what? So this is why you have to advocate for yourself.
Right. And you have to speak to anyone that you can that you think might have good information.
And so many people have white coat syndrome. They're scared to death. The white coat said so.
yeah.
Why are you doing that? The doctor told me to.
Yeah.
Did you check out the doctor? Does he have any lawsuits? Do you know anyone else that went to him? Because I could have had a major surgery that comes with complications.
Yeah.
People get scar tissue, adhesions on their bowels, things that are life-threatening from surgeries like that.
Yeah, I haven't been to the gynecologist in 4 years.
Oh, that's a problem.
Need to go.
That's a big problem.
You need to
I'm
go.
afraid.
No, you got to go.
Yeah, you got to go.
You have to
I think
go.
I'm scarred from my gynecologist.
Then you need a new one.
I need
Yeah,
a new one.
you need
Yeah,
to go.
you
That's
to
gotta
get
not
me
even
a new one. That's not even
Don't
funny.
I wouldn't
No.
mess around with that.
No.
No, I've gotten all my testing done, but I have not got. I've gotten a sonogram. I've gotten
Right.
a vaginal sonogram, but I have not gone to the. Sophia.
Have you gotten a mammogram? Have you done all
Yes,
that?
I've
Okay.
done all
Yeah.
that, but yeah, no, I haven't. And
Yeah,
my
okay.
doctor was crazy. He would call me if I missed my yearly appointment.
Wow.
He would call me like a crazy person. I need to see your vagina. I haven't seen your vagina. And I'd be like, oh, that's just so creepy to me. Like, why are you saying that you
The
need to see
doctor
my
himself
vagina?
called asking to see your
yeah.
vagina. That sounds like a
Yeah,
lawsuit
that's
to me.
odd. That's really
I mean,
odd.
I
No,
wouldn't go to
no,
him
that's
either.
why I was like,
Yeah, no,
oh,
yeah.
you know, like,
Wow.
okay.
Yeah, that's major ick
It's
factor.
major ick. But that's the way I feel about the GLPs and the Manjaro and the Ozempic is that it can prevent so many different diseases and obesity
who's
and this
But
and that.
prescribing it?
obesity,
Yeah.
but hold on, obesity causes a lot of problems.
Right.
So, if again, and I'm on it, so I'm not, but if we lost that weight, if there was a way and we lost the weight naturally, whatever it is, it's the obesity that causes the problems.
Right.
Right. So, yes, this is, but we have to call it what it is. It's an aesthetic quick fix.
No,
Right.
I don't feel that way.
Yeah.
I don't.
I feel like I crave healthy food. I can't eat a piece of fried food. I can't eat a lot of dairy. My body wants protein and clean food. It's the strangest thing. It feels really good though when I eat and I eat clean. And I used to eat fried food, and I used to eat, like things I shouldn't eat. I don't look for that anymore. So isn't that in and of itself, right?
No, but
Feels
I think
so
when
good.
you say it's a quick, you're 100% right. Is it a quick fix? Absolutely. But I'll tell you that I never felt so good.
Right.
I agree.
Physically
Me too.
and mentally on
Me
it. So
too.
if you're going to
It
tell me,
promotes good
okay, you're
health.
Ingrid, you're 197 pounds and you're addicted to food. And so I don't know what's going to help you. And you're going to keep going up to 200 or whatever.
Right.
And I'm sitting there like, okay, I'm afraid to even go to my mother's house because I know I'm going to have meatballs and cheese and this and that. And it was the only thing that really helped me. I was addicted to food. And
Look,
that's
I'm
why I
not-
say it
And
mark
the
my
underlying
words, this is
things-
going to help people with addiction. I
Carotid
truly believe
artery,
it.
heart disease for women that, does get a good enough amount of press, right? But for a long time it didn't. Women didn't know that women die from heart disease.
It's the major cause of death in the United
we know
States,
that now.
correct?
Right, we know it now. But so what's wrong with it being the quick fix? It gets rid of all the cravings for all the bad things, because at the end of the day, you are healthier in so many ways.
Right, at the end of the day,
Physically,
you're healthier,
mentally,
so-
right?
right.
Think about it.
And I'm not disagreeing with that. Believe me, again, I'm on it. I'm just as devil's advocate.
Right.
It helps us to not need. I mean, there are people that are absolutely addicted to food. I mean, I may be one of them. I love food, but it helps us to do something that many people can do without it. But it's easier to take the shot.
Yeah.
I'm all about easy. I take the shot. I do.
Yeah.
But it's the excess weight, or the loss of the excess weight, that makes us healthier.
Right.
So there is something to be said for willpower. People can still do it
Right.
without the shot.
Right. I agree with you. But like someone like me, who I work out at least 5 days a week, I eat well for the most part. And I could have a quarter of what you guys eat and blow up like a balloon. In one weekend, I could gain 5 pounds.
Yeah. I mean, look, I gained, before I gained 5 pounds in a week.
Yeah.
So I get it.
Yeah.
Just saying, for people that don't have access or won't go on the shot or can't, there are people that can do it without the shot, and it's the obesity that creates the sickness, right? So
And
that,
let's talk about where you're getting it from. So a lot of these, telemed, right? Or you're online, you're on Instagram, it comes up, they have all these different platforms that
Let's
you
talk
can get
about
it.
TikTok Shop.
See, I don't really
I
do
don't
a lot
have
of
TikTok.
TikTok.
I think I know.
Wait, you can buy
addicted-
it on TikTok?
No, but I'm saying
Oh.
I'm addicted to TikTok Shop.
But I think it's important that you go to a doctor who specializes in bariatrics, a diet doctor who knows everything before Mounjaro and Ozempic about dieting, the cycles, the uphill climb, right? There's
Right.
all these peaks and valleys, and I think because there's a psychology, there's a whole piece of, like you said, with the eating. Being addicted. I used to find myself grazing in the kitchen on a Saturday, right? I was just constantly, I'd
Thinking
eat and then
about
go
food. Me
thinking
too.
about food. So like, it's good to have a doctor who really understands the discipline of weight loss medicine,
Right.
and they're out there. And they may seem a little different, because they are very different. But I don't think your regular internist has the same amount of knowledge. Definitely not.
No, and it all stems back to going to find, researching. It's like a
Yeah.
full-time job. Where are
Yeah.
you going to get your
That's
health
the
care
problem.
You
from?
know yourself best.
Wait, I
and-
heard about there's this place on Long Island that has like one-stop shopping for women. It has everything that you could possibly imagine. I have to find out where
Well,
it
that's
is.
the new trend, right? From the womb to the tomb, all the things, right?
You go from
There-
door to door to door to door, and it's everything all in one.
I
think it's
haven't
in
heard
like
of that
Success.
yet, but it's a good idea.
Like what kind of everything?
Like everything from an orthopedic to a gynecologist to oncology, like everything for women.
Okay.
they accept health insurance.
Yeah.
Wow.
I have to find out where it is. I just heard about this. I don't know who I
great.
heard about it from. All right, now to close, now that we've got on the Ozempic topic, it's funny because I'll be out on the street and I can tell right away if someone is on Ozempic that
Really?
was like really heavy and then they
How?
lost a
Everything
lot of
drops.
weight. Just
Everything
by
drops.
their face, their neck. I mean, I see so much Ozempic body and Ozempic face.
Well, we see it
I'm
all
one
the
of them.
time. I have fat skin. I have thick skin. So I never, I get a little caved in, but I'm lucky. Like I don't, but I see a lot of, so as an aesthetic practice and working with lasers, we want to plump the skin.
Yeah.
So there are a lot of non-invasive ways of getting, collagen induction therapy into the skin without the shots, healthy, tools that help with the appearance of Ozempic face, a little bit skin tightening, but naturally.
Right.
We work with AccuFit, which is an incredible body sculpting device, because along with Ozempic face, we're seeing muscle mass loss. When you lose weight quickly, we lose the muscle mass.
Right. So that builds up your muscle, which then again plumps up your.
Yeah.
I tell people, start as you're losing weight, start coming in and getting the skin treatments to build the collagen, to tighten the skin, to build the muscle, whether it's abs, core, butt, because it's like the girls who are out all summer and they get this horrible sun damage, and then they're in my chair in September.
Right.
Oh, can we fix it all at once?
Yeah, right.
You want all the brown spots gone
all at once
by October 1st.
Right. But as you're out in the sun, if you're wearing the sunscreen, the less you could, there's only so much we can correct all at once. So if you're on that Ozempic, then, start building the muscle in the gym. Find a practice that's reputable with body sculpting devices or lasers that can build collagen. We do it. We're not the only ones. I'd like to think I'm the best, but there are.
You are.
I'm doing it a long time, but there are, certainly providers everywhere.
Yeah, but I definitely think getting in the gym and lifting those weights, you have to have weight management.
Weight-bearing
Absolutely.
exercises.
Yeah,
of
whether or
course.
not you're on the Ozempic.
Yeah, it doesn't matter.
Absolutely.
When you get
just
older,
it's,
you need those weights.
Yeah, you do.
Absolutely.
Yeah, very important. Because then you're so prone to injury if your muscles are weak, so
right.
can't risk it.
Do things that your older self will thank you for.
Yes.
Right.
Okay, so I'm going to say thank you for listening. I'm really glad that we got together.
Yeah.
And I'm glad that we were able to put out really great information, and there's so much more to come.
Yes, so much more to come. And I'm so glad that we're finally opening up and just talking real talk, which is so refreshing. And I love hanging out with you guys. And thank you, Jay.
Thank you for the
Thank you, Jay.
opportunity to get the word out.
Yeah, we're going to keep it going.
Yeah, we're going to make it
We'll
okay.
Keep it going.
All right. Peace out.